And now I'm happy to introduce our next speaker. So it's Stig Erik Sörheim. You are head of the International Department of Actis. I don't know if everyone knows what Actis is.
I have a slide on that.
You have a slide on that?
Yes.
Perfect. So well prepared. Thank you so much.
Yes.
And you are going to give us a summary of the drug policy in Europe.
Yes.
Thank you so much. The floor is yours.
Thank you, and thank you for the invitation to come here. Yes, my name is Stig Erik Sörheim. I work on the international level for Actis. We are involved in alcohol policy, drug policy, and gambling. We are in many ways a sister organization of SLAN in Sweden or IOGT-NTO in Sweden. We are an umbrella organization like SLAN. We have 36 members, different types of organizations, from youth organizations to self-help groups and treatment organizations, minority organizations. And we work to promote evidence-based policies in the field of public health. So I was asked to talk about drug policy in Europe, and there are many topics I could cover, but I think that the most interesting right now is cannabis. Because there's a lot of policy development in the field of cannabis policy. I think for the American guests here, I think, you know, historically Europe has been seen as more liberal than the United States. The United States has been sort of famous or infamous for a war on drugs, whereas Europe has been seen as more progressive and more liberal. And I think typically they've pointed to Portugal and the Netherlands as examples of European liberal policies. And I think it's perhaps true that there's been less of a punitive approach than the United States, but there are quite large variations within the region. Cannabis policy and cannabis legalization has been on the agenda for many, many years in Europe, but it's mostly been on the periphery of the political landscape. So it's been like very small parties that have promoted legalization, or citizens' initiatives. They've collected signatures and they got 5,000 signatures, and so now they have to debate it in Parliament, and then the Parliament says we don't want it. So, but in recent years, and Europe has been, although Europe has had a more public health oriented and more human rights oriented policy, they've been quite loyal to the UN drug conventions. But in the past couple of years, since 2017, 2018, cannabis policy and cannabis legalization has moved to the center stage of European policies. And I think that's a function of what's happened in the United States and in Canada. So now, the United States and Canada are driving the legalization debate. Just to give you an overview, cannabis use in Europe is much less prevalent than in the United States. I don't know if you can see this, but in Canada, around 27% say they have used cannabis in the past year. In the United States, around 18%. These are a couple of years old data, but it gives an impression. In Europe, it's 7.7%. So 1/3 of the North American level. But there are quite big variations within the region. So typically, Southern Europe has higher rates of cannabis use. Northern Europe, Norway, Sweden, Finland, relatively low rates. And we also see cannabis as a problem drug in Europe, increasingly. The European Monitoring Center for Drug and Drug Addictions say that the most common drugs that people now seek treatment for is cannabis. It used to be heroin, now it's cannabis. So more than 1/3 of all new treatment seekers seek treatment for cannabis use. And we've seen the same tendencies that we've seen in the United States, that the potency of cannabis has increased over the past decades. It's quite a complex political landscape. When I give these presentations, I always have to update them because there's always something new since last time I gave the presentation. So we see developments in many countries and in many areas, typically medical use. We've seen increasing prevalence of CBD, which is not psychoactive, but it's part of a cannabis industry and cannabis culture. We've seen production of hemp, That's also an issue in the United States. And I think that raises the question of how do you control the cultivation of hemp, which looks like cannabis and can be used to extract CBD and also other intoxicating products. And then there's the discussion of recreational use in more recent years. Let's talk about decriminalization. We've heard about cannabis clubs, home growing, and now also legalization of commercial cannabis. And I'll get back to most of these issues. But at least when I try to describe cannabis policy in Europe, I feel that it's a moving target. So the picture, this is a snapshot of what I've sort of can find out today. I know in 2 months there may be new developments that need to be covered. The medical use of cannabis and cannabinoids has been a very important driving force for cannabis legalization or liberalization in the United States. We see this push in Europe as well. This picture is from the Hemp and Hash and Marijuana Museum in Amsterdam, that shows all the healing properties of cannabis. And the list is much longer now, because whatever new disease is coming up, cannabis will always be a cure. So during COVID, of course, cannabis was a cure for that as well. And if there's a new epidemic, then I'm sure cannabis will help. But at least in Europe, you could say that medical use of cannabis has been more evidence-based than the United States, more doctor-led than in the United States. So patients who receive cannabis or cannabinoids in Europe will typically be followed up by doctors or by their doctor. It's not a cannabis dispensary system like you have in the United States, where people just get a recommendation to use cannabis and then they go off on their own and use whatever cannabis products they enjoy or like or feel help. Most of the medical use of cannabinoids has been medical products with marketing permits. So these are pharmaceutical products that have gone through testing and approval by medical authorities. So typically it's Sativex, Epidiolex, and some other medicines. Relatively few people get raw cannabis, like cannabis plant material that they use. And no countries recommend smoking. There are some standardized raw cannabis products out there. There are some Dutch companies that produce cannabis with, let's say, for instance, they predictably can say that they have 10% of THC and 5% of CBD, for instance. They test, and so the user will know what kind of concentration or what the content of the cannabis is. And cannabis is not approved as a medicine in Europe, just like in the United States, it's not approved as a medicine. There are some special schemes, so patients who have special ailments, special illnesses that don't get the desired effect from their normal drugs, from the normal medicines, they may try out cannabis under supervision of a doctor. And usually these are exceptional schemes, so in most cases patients will have to pay for this themselves. So that limits the number of patients. But there is no standardized European regulation, so there are different rules in different countries. But I also think we need to look at the market aspect of it. I know Staffan Hübinette will talk about the cannabis industry later today, and I think we need to be aware of this. We are seeing commercial cannabis producers in North America, particularly Canada, who are very interested in the European market. Germany is the biggest medical market in the world, and Canada has been the biggest exporter of cannabis. They produce too much cannabis in Canada, and they need to get this out to the market, or else they lose money. So Europe has been a very attractive market for that. And we also see that North American companies are investing in Europe. I think they're doing this to get a foothold in the European market if or when it opens up. So they're buying up companies, they're buying up growing facilities, distribution systems, and they hope or expect that there will be progress. I'll get back to the German issue later, but there was great hopes and the great expectations in the cannabis industry for the newly commercialized cannabis market in Germany. And there's cannabis growing in many countries. Many countries are now allowing the growing of cannabis for medical purposes. But so far, the medical market is relatively small in Europe, with a possible exception of Germany. I think that there is a potential for growth, but the big potential is in the recreational market. There is no... The projections from the cannabis industry shows that it's 10 times bigger than the medical market. So that's what they're looking for. Another issue that's come up in recent years, it's so recent that I've noticed it in my career when I travel around Europe, is the emergence of CBD. And this has come on the European market since 2017, 2018. So it's a relatively recent phenomenon, 5-6 years in most countries. And this is tied to some decisions by European authorities. European food safety authorities decided that CBD is not a drug; it's a novel food, and novel foods are food products that come onto the market relatively recently. And in order to get on the market, you have to prove that it's safe, and it's safe for everybody, not just for adults. You can't put a food product on the market that's just for adults. It has to be safe for everybody, and there are quite strict rules for approval, and no edible cannabis or CBD product has passed that test yet. It's quite costly, and it's a big gray zone here. In addition, the European Court decided that CBD should not be regarded as a narcotic drug. And that means that it's up to the countries themselves to regulate this. Some decided that it was a food supplement, some decided it was a pharmaceutical product, some decided it was whatever. I mean, there are different rules in different European countries. And this means that there's a huge gray area. I think it's mostly illegal, but it's gray, and so gray that the police or the authorities haven't really regulated it. So these are pictures from stores that I've taken in different European cities. These pictures are from a store in Vienna this March. There's a large variety of products: edible products, smoke products, cosmetics. It's very typically symbols from cannabis culture. So I mean, if you look at the weed buddies here, there's no doubt what this is. Although they say that they sell CBD, which is not psychoactive, which doesn't give this effect at all, they still use this imagery. And the market analysts say that the CBD market has now moved from being sort of an experimental market into becoming coming onto the branding stage, where consumers are not just trying out products, but they are sort of developing preferences. The different producers are sort of finding their market niches and developing their products to target specific consumer groups. And you also see a consolidation in the industry. It used to be a lot of small operators who are producing these strange products, these niche products. Now we see more bigger groups, bigger companies buying up small startups and starting a branding process. And I think this is partly because there's money in CBD, but partly also to create the brands and the distribution systems for full legalization. So they're sort of developing the infrastructure for legalization. And we've seen the same thing that happened in the United States with new hemp-derived products. I said that there was a big gray zone here, what's legal and what's not legal. And one of the things that has happened is that the cannabis industry has started producing intoxicating or psychoactive substances from CBD. In the United States, they have typically delta-H THC, delta-10 THC, and some other products. In Europe, it's been HHC, which means hexahydrocannabinol. Again, I was in a CBD store in Vienna recently, and the lady there told me that if I bought this, I would get just as high as from THC. This picture is a vending machine that's open all night, sells HHC products to anybody who comes by. Only cash, which I think is really interesting in terms of money laundering and crime. So you have to verify your age with your credit card, but you can't pay with your credit card. You have to pay cash on this machine. So, and these are the products that they're selling 24 hours a day. We don't know very much about, perhaps Bertha knows a little bit about the long-term and short-term effects of these products, but these are so new products that they haven't really been tested. We don't know exactly what they do or not do. We can assume that they are very similar to THC, but we don't really know. And what's happened is that the countries are scrambling to regulate these. Just this year, 11 countries in Europe have regulated it. And some countries already, like Norway, already have legislation that covers this. So increasingly, these products are banned. But it's been an interesting thing. I know the US authorities are also working to ban Delta 8-THC, and some of the other hemp-derived products. But the point is that hemp is legal. Products derived from hemp are in principle legal. So CBD will be legal. And what the legislators, I don't think they realize that you can further process CBD and get these psychoactive substances. And so they've created this loophole in the legislation. Another issue that's been around in Europe for many years is the so-called cannabis social clubs. Some countries, I think particularly Spain and Belgium, have seen the emergence of cannabis clubs, which are really like non-profit growing operations that grow cannabis for members. It's only the members who can come there and get the cannabis. There's a limit to how much you can buy. You have to use it in the club, and in theory, it should be non-profit. They are illegal, but it's always a question of how highly the police prioritizes enforcement. And in many cases, the police has not really prioritized enforcing the laws. And what's happened is, in some places, these clubs are not non-profit. They are more commercialized. One of the issues is, where does the cannabis come from? And in some cases, it's been organized crime that are providing the cannabis that are sold or distributed in the social clubs. So it's an easy outlet for cannabis gangs or cannabis criminal groups to get rid of their cannabis. And also there's an issue of sale to tourists. So if you go to Barcelona, it would not be difficult for you to get a membership in a cannabis social club. You'll pay, I don't know, 20 euros, 30 euros, and then you get the first doses for free as a member. So it's again, it's a gray area. So far, it's been very clear that these are not really legal, and they could be shut down anytime. And if they grow too big, or if there's too much nuisance around them, then the police will enforce the law. What we've seen in recent years is new developments. It started with Luxembourg in 2018, where the new government promised to legalize cannabis. They wanted to limit the black market. They wanted to reduce youth use. The rhetoric was very similar to the rhetoric of Justin Trudeau in Canada. They would get this right. Now they would get this right. Then we need to rethink the cannabis control policy. The proposal met with quite a lot of resistance in the neighboring countries. So they came up with a revised proposal that was presented in autumn 2021, which says that adults can legally grow up to 4 plants, and they would open cannabis clubs. It's not full legalization because there's no commercial market, and there are quite strict penalties if you break the laws. So if you use cannabis in public places, or if you sell cannabis, or if you give it to somebody else, then you can get quite high fines, and even criminal sanctions. Then a couple of years later, in 2020, Malta started talking about. Malta is a very small country. I don't think you can see it. It's a little red dot in the Mediterranean. 500,000 people, but they wanted to legalize personal use and possession. it started out as a plan to legalize, but again, it was scaled down to become personal growing, or growing for personal use, and cannabis clubs. So again, as you can see, for instance, if you use it in public places or with children, it's 500 euro fine. So it's quite strict laws. Perhaps just as strict as it is today. So it's not really a very, very comprehensive legalization. And they also proposed a lot of regulations for the social clubs. I don't expect you to read all this and to remember all this, but the point is, it's very, very clear that these social clubs need to be non-profit. They will be very tightly regulated. There will be quite high fees to register. They have to pay money to various good purposes. They have to pay part of their profits to harm reduction, part of their profits to community projects. And I think that the problem so far is that no cannabis clubs have opened on Malta after 1.5 years, and the regulations make it quite difficult to operate. And since it's non-profit, there's a limit to how much development, how much investment you can make in growing equipment and in sort of processing your products. And the critics will say that there's no way that this can replace the black market. And I think the critics are right. This is it's a very tightly controlled social club. It will not be able to produce enough cannabis. It's not profitable. So it's difficult to see how this can replace the black market. It can add. You can grow your own. You can be member of a social club, or you can buy on the black market. I think so. You will have three ways of getting your cannabis after this legalization proposal. Another country that's not member of the European Union that is doing quite a lot in drug or cannabis policy is Switzerland. They have started trials with legal sales of cannabis. They're relatively small trials, I think around 400 people who can buy cannabis, tightly controlled. Only people who already use cannabis can become part of these schemes. And it will be followed by researchers. They will collect data on consumer behavior, but it's very clear that the intention is to provide information for future legalization. So when you ask, it's interesting to see what kind of research questions they ask. They're not really asking, will this improve the public health? They are asking, is it possible to make people switch from the black market to the legal market if you offer cannabis legally at a lower price than the black market? Those are the kinds of research questions they're asking. So it's an interesting approach. I'll get back to the idea of trials on the next slide. They have quite strict regulations. The product has to be organically grown. It shouldn't be like, it should be very clean and pure and safe. Less than 20% THC. You're not allowed to market. There should be health warnings and labels, and there should be doctors monitoring the program. Currently, there are 5 trials underway in Lausanne, Basel, Zurich and Geneva, and one more, which I didn't put on there. Okay, anyway. The trials can be run by private companies, by NGOs or local authorities, and they have to be, there has to be a research component. So why are these trials? I think one of the reasons that the Swiss authorities actually said openly in some documents is that this is to comply with the UN drug conventions. The UN drug convention says that you cannot use cannabis for recreational purposes. It can be used only for medical purposes or for research purposes. So then they add, so they legalize cannabis and add a research component and says this is a research project. So they argue that this is in compliance with the UN conventions. I think that's a very doubtful interpretation. I think it's easier to overcome resistance in the population when you say it's a limited trial. As the slide shows, cannabis legalization has been proposed twice in recent years, and it's been rejected both times in Switzerland. And it's the first step towards full legalization, very clearly. The Swiss government is talking about legalization. We don't know if the trials will continue after legalization, if they will wait until the trials are done before they legalize. And I'm pretty sure that the very strict rules applying to the trials will not be continued after a possible legalization. So the big elephant in the room is Germany. The German coalition government that came to power last fall, I think, yes, promised to legalize cannabis. And they promised full legalization, commercial legalization, not like Malta and Luxembourg with home growing and cannabis social clubs. They promised a legal supply chain, sale through licensed shops and pharmacies, and all the trimmings of regulation, age limits, labeling, health warnings, bans on advertising, all these sort of public health-oriented measures. And they also said, because of the UN drug conventions, they're not allowed to import cannabis from other countries. They said only cannabis grown in Germany could be sold on the German market. But it was quite predictable. This is one slide I didn't update because these were my predictions, and I was kind of right, so I kept the slide in. The legalization plan in Germany clearly violates the UN drug conventions. So we didn't know what the German government would do, because other countries like Canada and the United States have just flaunted the conventions and just gone ahead and legalized. But Germany has been more loyal to international agreements historically. Germany is also part of the EU and the Schengen Agreement. The Schengen Agreement is the police and customs collaboration in Europe that allows people to travel freely across borders in Europe. So clearly, legalization in one country will very easily impact on neighboring countries. Also, legalization is in conflict with several binding European laws. And a practical issue is that the domestic production that they promised would be nowhere near covering supply or covering demand. So just for scale, Germany now produces 2.6 tons of cannabis. They estimate that the demand would be 400 tons. So it would take many, many years before the legal production in Germany would be scaled up to cover demand. The interesting thing is that there are 4 companies that are licensed to grow cannabis in Germany now, and 2 of them are Canadian. So it's just an illustration why the North American cannabis industry has been interested in investing in the European market, because it gives them a position, that gives them a foothold in Europe. What happened was that Germany launched a revised plan in April this year, and it was significantly watered down. There would be no commercial cannabis market. There would be limited home growing, just up to 3 plants per year. So it's, in a sense, it's not very. You know, when I talk about decriminalization, I usually say decriminalization is about the use of cannabis. Legalization is about the sale of cannabis. So there's a sort of a gray zone, that this home growing thing is a gray zone between decriminalization and legalization. There are some countries in Europe that already allow home growing. Netherlands, the Czech Republic, and perhaps some others that have decriminalized home growing. So what they're proposing is not really a legalization plan. It's more of a slightly liberal decriminalization plan. In addition, they will allow non-profit cannabis clubs. And the rules that have been proposed for the non-profit cannabis clubs they're quite similar to the regulations in Malta, with age limits, advertising bans, strict records of production, sale, inventory, so that the cannabis that's grown in the cannabis clubs should not leak into the black market. Strict safety requirements, so you cannot grow this openly. It has to be behind bars or behind locked doors. They even have to have a youth protection person, a specially trained prevention person employed by the club. And when I say employed by a club, keep in mind this is a non-profit. So the people who work there can get a salary, but they can't make a lot of money. And in Malta, the government even limits how much money you can make from working in a cannabis club. So if you're manager of a cannabis club, you can't just allow yourself a huge salary. So it's quite strict. This has clearly been a great disappointment for the cannabis industry. Some said that this has postponed legalization in Europe by 10 years. And there might be something to it, because if this is the model that's being developed, then they will try out this model and they will perhaps reject it at a later stage, but it will delay the process. And I think that's an important issue for us. I think that the industry is now pinning their hopes on medical cannabis in Europe, in Germany, and also Germany has proposed regional or local trials with cannabis sale, just like Switzerland. They haven't launched the detail or haven't published the details of these regional trials. They say that the details will be published after summer. But that's, of course, an opportunity for some commercial growers to actually make money from cannabis in Germany. Also, we see that there's a group of countries, Germany and some other countries, have joined together to create an alliance of like-minded organizations that are working to reform cannabis policy. So Malta, Luxembourg, Germany, the Netherlands. I haven't mentioned the Netherlands, but I could give a presentation on the Netherlands as well. And recently the Czech Republic have all joined this little alliance. And I think that the long-term goal is to change the rules. And I think that's a sort of it's a fair way of doing it. If a majority of countries want to change the rules, then that's one thing. If one country goes ahead and breaks the rules and creates a domino effect, I think that's quite a different thing. But I think it will be interesting to see how strong the government commitment is. My feeling when the Germans launched their plan was that the support for full legalization wasn't very strong in the government, because what they delivered was a very watered down version of their campaign promises. Again, I know that Stefan Hübinette will talk about the cannabis industry, but this is increasingly becoming a player in Europe as well. And we see the blueprint for legalization. The medical use of cannabis, industrial hemp, CBD, and cannabis for intoxication or for recreational, so-called recreational use. The North American companies are fighting for positions in Europe, and they constantly work to increase access to cannabis. I mentioned before, they are establishing the infrastructure that they need to roll out full legalization. And I think they were very keen on this when Germany launched their plans, because I think that they saw this as it's just around the corner. They're disappointed now because the corner may be 10 years further ahead, but they still have their eyes on the goal. There's no doubt. But they're creating their brands. They're growing. They're establishing their growing facilities, their factories, developing their technologies. Perhaps copying or transferring experiences from the North American markets. So they're ready to go if or when the dam breaks. And what they are hoping for is, of course, the domino effect. Stefan has used the word collective security. The UN conventions create some sort of collective security where it's one for all and all for one. The countries were solid. There was an element of solidarity between the countries. They agreed nobody does anything on this without agreement from other countries. And legalization in the US, Canada, and Uruguay has undermined this this solidarity. And this means that the countries are more left to their own devices. So if you get a government or a government coalition where one party really wants to legalize, that used to be off limits. That used to be, it's not possible because there are international agreements and international conventions that regulate this. Now it's more of a gray area. If they want it strongly enough, then maybe we can do it anyway. But so far, the European countries have stopped short of full legalization. So this is the interesting slide. Last slide, and then perhaps the most interesting slide. What does the future hold? The European countries have not challenged the UN drug so far. With the new German plan, they haven't challenged the UN drug conventions head on. They are pushing the boundaries with their trials, but it's not a full-out rejection of the UN drug conventions. They are building this alliance of like-minded countries, so we'll see how that goes, how much commitment there is. These are democratic countries. There are elections every 4 years, 5 years. So there will be changing governments. Maybe not. It will be difficult to keep up the momentum for over a long time. And you can ask, are we looking at a new European model of non-commercial legalization with these cannabis clubs and home growing? I must say I'm doubtful because I don't think it's sustainable. I don't think that this non-commercial legalization will be able to cover the demand in the market. And one of the big arguments for legalizing is to fight the black market. And I don't think, that's my personal belief. I don't think that they will be able to do that. And I think that the figures from Germany are quite illustrate this. I don't remember. They produce four tons of cannabis, and they need 400 tons. How can these non-commercial amateur social clubs cover that kind of demand? I don't think it's possible. What we see is cannabis policy changes in many countries. I mentioned CBD, hemp, medical use, decriminalization, softening of laws, cannabis trials, etc. So one possibility is that the cannabis regulation in Europe dies a death by 1,000 cuts. It's not like it's abolished. It's just that it's constantly undermined, so that in the end you will not be able to control or there's no real control or no real enforcement of the laws. I think that's partly what's happened in the legal markets in the United States and Canada. That it's the laws. I'll get back to that. I think some people say that this is bound to happen. Cannabis legalization is bound to happen, and I think that's wrong. I think that there's an element of self-interest in this when they say this. They want to create the image of a process that you cannot stop. But I think it comes down to political will. What we see from our own countries is that there is no huge appetite for legalization among the population and not among the politicians. So the question is, if there is political will and awareness, I think it's not a law of nature. But the one challenge is that we are seeing a global cannabis industry that is working very actively to expand their markets. And that's a new phenomenon. I mean, it used to be criminal gangs, of course. They used to work with to expand their markets in their own way. But these are professional organizations that work to influence policy. And we've seen them being active in many European countries over many years. And I think perhaps Stefan will, for those who are interested, will provide some details about that. And I also think that one of the really important things now will be the emerging data from the legalizing markets. We need to learn, we need to see what happens when you legalize and to learn from that. And no matter what Europe does, we will benefit from learning from that experience. And the final point that I want to make is that cannabis policy and legalization is not an on-off switch. I think it's more like a water tap or a faucet that you can turn up and down. And what we've seen in the countries or areas that have legalized is that they've already opened up quite a lot before legalization, and legalization is just a further turn of the tap. And the problem is maybe that once you legalize, it will be very difficult to turn the tap back. That's the main challenge. Okay. Thank you.
Thank you so much for extremely, I would say, hopeful presentation.
Yeah.
You know,
I was not that optimistic 2 months ago.
No, no. So good job, everyone, doing also, working against it. Because I was talking, one of the breaks that in Germany, for example, how are the opposing parties? How are they reacting to the proposal of legalization?
Yeah, one of the things they did was to commission a report that showed what I said about the problems of European laws, European legislation, that showed that this is in violation of UN conventions, this is in violation of European law. So that was one of the things they did. The Christian Democrats in Germany are not pro-legalization.
I'm happy about that.
Yeah. So, and I think that the Social Democrats in Germany are also divided on the issue. It's the Liberals and the Green Party that are promoting it. So, and it was a result of a trade-off in government negotiations. So I think that maybe parts of the Social Democratic Party in Germany are in two minds about the whole proposal, and maybe happy to see a watered-down version of it. That's my suspicion.
Yeah, but I think it's important to also brief the Swedish government about this, and all of you have connection in different countries, because it is important to increase the awareness of it, because the problem is always when something is happening a little bit in the background.
And I think that the difficult thing is the death by 1,000 cuts, because there are small changes that are not in themselves significant or very significant, but they all pull in the same direction. And none of us are against hemp. It's a plant. You can use the fiber for stuff. That's not the problem. The problem is, how do you control it? How do you regulate it? What do you do when you can produce psychoactive substances from hemp?
Yeah. Thank you so much, and no questions in the system. So this time I'm not going to be a good person because we're running out of time. Yeah, but we're going to give you, in your name, we have the gift to UNICEF.
Great, thank you.
And chocolate.
Thanks, perfect.
Thank you.
Thank you.
Thank you so much.